Hi, I'm Neil Wanger. I'm a general internist, a primary care doc, and also I work with the UCLA Health Ethics Center. And I'm here to talk with you about advance directives. What's an advance directive? It's a legal document that allows you to indicate what kinds of things you would want done if you couldn't make decisions for yourself. Now, why would that happen? We know that optimally, doctors and patients work together in shared decision-making to make sure that the kinds of treatments that patients receive reflect what patients would want. But under unusual circumstances, patients can't talk with their physicians about what they would want. Perhaps they're too sick, or perhaps something horrible happened and they're not awake. Under those circumstances, who would you want the doctors to turn to help make decisions for you? Maybe it's a spouse, perhaps a sibling, maybe even a friend. And if it is a friend, would the doctors know to turn to that person? Probably not. It's for those reasons that people need to complete an advance directive. So the advance directive is a legal document that allows you to write down who it is that you want to make decisions for you. And you can also write down second and third people as well if the first one can't do it. But more importantly, it also allows you to indicate what kinds of treatments you would want if you weren't well enough to be able to make the decisions for yourself. Take, for instance, and none of us like to think about this, if you were so sick that you weren't going to get better, or at least better the way that you live now. People complete advance directives in order to think about the kinds of things that they wouldn't want medical care to do to them, or the health states that they wouldn't want doctors and hospitals to keep them in. For instance, I will frequently, especially if someone is completely healthy and has no medical problems, ask them, what if driving on the freeway today, a truck rolled over on top of your car? Now, no one likes to think about that. That's why we wear seatbelts and drive safely. But in the very rare occurrence, and unfortunately in Los Angeles it's not that rare, that something horrible happens to us while driving, it's possible that you as a person will never be that same person again. What if you weren't going to wake up? Would you want the doctors to keep you like that? And who should be turned to answer that question? And when the doctors turn to that person, would they know what you would want them to say? That's what the advance directive is all about. It allows you to think about these things in advance, even if we don't feel like thinking about them, to actually put them down in writing in the advance directive, and to discuss them with our loved ones who are going to be our decision makers, also specified in the advance directive, and hopefully with our doctors. If doctors and family know what we want, then those decisions turn out to be much better and much easier on our family that have to make them. So the next time you visit your doctor, say to them, hey doc, during the visit today, how about if we do advanced care planning?